Pennsylvania, and talking about hydrogen fluoride.
So yes, that is the topic for today. I'm working with hydrofluoric acid, or HF, talking about safety protocols with it. So the first is, what is it specifically? It's one of the strongest inorganic acids that we have access to. It is 100% water soluble, so that's not really surprising for a hydrofluoric acid that it would be like that. In its natural state, it has a boiling point of below room temperature, so that's good to know if you are putting it into solution. Naturally, it evolves off at below room temperature. And so when we were working with it inside of our labs, we work with it usually in liquid phases, gas phases, or most typically as solutions. And so that's good to know of all the different ways that you can come into contact with it, so it can evolve off of a solution somewhat, so you need to be careful that you work under fume hoods and things like that. And it's most often used for etching processes, sometimes in tandem with others like nitric acid or hydrofluoric acid. It's used for etching glasses as well as things like tantalum, which is what we use it for in my lab. But because of that, you need to be careful of what you're actually keeping it in. So for example, the manufacturer provided a container for it, shown in the top right, is a polymer that's resistant to it. If you put it inside of a glass beaker, it will begin to eat away at the beaker, so you need to make sure that you're using the correct materials with it, which for pretty much any chemical you need to be aware of. I do talk about the MSDS at the end, but this is like a good law for anything that you're working with. If you don't know what it is or what it's going to do or what to use it with, always look up the MSDS. And then most importantly, it's colorless, fumes white, smells similar to hydrofluoric acid, has like an acidic smell to it, but hopefully you won't be smelling it because that's a bad time waiting to happen as well. But it doesn't react in the same way that hydrofluoric acid often does too. So the main reason we're talking about it is because of that bottom point, that it is highly toxic, and that's most of the safety things I'm going to be covering today. So the health risks associated with hydrofluoric acid. It's very, very good at penetrating into the human body and working its way into the cells. And as soon as it goes in, it will start reacting with the body, so it creates necrosis, I believe is the term, where it basically kills your cells off. But aside from just doing that bad stuff, like, that's always fun, it will then break down and the fluorine anions will begin to react systemically with all of the calcium in your body as soon as it starts to connect any of it. And in fact, fun fact, there's enough fluorine atoms in 7 milliliters of anhydrous HF to bind to all of the free calcium in your system. So this stuff is definitely nothing to mess around with, because very, very small quantities can do a severe amount of damage to you and create hypocalcemia. So one thing to note then is that all HF exposures do require first aid immediately and then some sort of treatment with a medical facility afterwards. So always follow up as soon as you know that there's been a contact. So what to do? First aid and treatment. This is another thing that's sort of very important and specific to HF as opposed to other ones. So the first thing to do is to flush the area if possible with water for 15 minutes. I'm sort of assuming that it would be a contact one, but do whatever is necessary for that specific type of spill and look into it again if you are working with this. So yeah, flush it with water for 15 minutes, which seems excessive, but the water does not penetrate your system as well as the hydrofluoric acid will, so that's why it has to be such a long one. And then if you're ever working with this in your lab, you should always have calcium gluconate on hand, either as a gel or as a nebulizer in case of breathing it in by accident. And that would be what you would immediately use after that flushing process. And you also need to seek medical attention. You should call the police during it in an ambulance anyway and go seek attention elsewhere. The reason that this is also really important and why it's often so damaging is that a lot of these things, the symptoms that you would see from it, don't actually show up during the time that it's happening or that you come in contact with it. So these are surface exposures and the onset times to having any sort of irritation to that area and it's spilled on you. And as you can see, I think the most common used concentration is 20 to 50% concentration. And that means that you probably won't feel anything for 1 to 8 hours afterwards. So if you think you've come in contact with hydrofluoric acid, act as if you have, because otherwise, by the time that it's 1 to 8 hours later, your body's already started reacting all of that calcium in your system, and you might die. So not to be messed around with. And they've shown that even with very low concentrations, if you cover an area of 25 square inches, basically 5 by 5 square like the back of your hand, if that amount of area is covered with a splash from it, then you may die, regardless of if it's at low concentrations. So scary stuff, but that's why I'm trying to make sure that you understand that we need to be as safe as possible when we're working with it. So the main point of this is that if you are working with HF, undergo trainings if they have it available in your area, and thoroughly review the MSDS to know what you're working with and how most safely to handle it. So make sure you know the location of all your safety equipment, especially where the calcium gluconate gel or nebulizer is in your area. It should be nearby where you would be working with that specific acid. But you also need, showers and eye wash stations and everything like that anyways. And make sure, again, that you're using appropriate storage procedures and PPE for that application. So again, you can't put it in glass because it will eat that away, so you need to be careful about that. And even just looking at what gloves that you would use, these are different materials. I know it's kind of hard to see, but it talks about the amount of hours that it would only take to eat through that material and reach you. So for example, a lot of acid wash stations use neoprene gloves, and those are only good for 1 to 4 hours of contact with that material before needing to be replaced. So just because you're using something that's normally safe, you need to make sure that in this specific circumstance, it's still a safe material and a good PPE for you. So again, make sure that you thoroughly review the MSDS, and I hope I didn't scare anyone too much with it. But that's,
Yep, you're good.
Yeah.
Yep, you're good. Thank you.